Greetings. Hello, Facebook family. I'm Joel Bullard with Assurance Healthcare Services, Chief Operating Officer, coming to you just because excited to share some news with you about our collaboration with Ms. Shigeo in reference to insurance. And so it's open enrollment time now, and we're excited about our partnership with her. And this is great for our existing staff members, and for those of you who are looking for the agency that cares about you, this is an opportunity for you to take advantage of a benefit that many families are searching for and that are thankful to have. And so we just hope that you would consider us if you're out looking, because we're an agency that cares, and we just want to let you know that. Thank you.
Hey, what's up, folks? How you doing? This is Coach Cecil. Listen, I'm super excited to have a special guest with us today. Listen, I love that this woman has been changing people's lives for so many years. There's something amazing about someone that's passionate about serving. And so this woman is a servant leader. She is passionate about helping others to be able to improve their quality of life. So what I want to do right now is introduce you to someone that's been an insurance broker for like 13 years, almost 15 years, changing people's lives, helping them to understand how to navigate and benefit from the insurance that they utilize, the various types of insurance that folks utilize. So right now I want to introduce you to Shigeo Abraham. And Shigeo, what I want you to do is just take a moment, let folks know who you are, give a little background on your I guess what you've been doing, how you got into the industry, and I can't wait for you to share with others. Please, Mike is yours.
Thank you, Cecil. Good morning. My background has been over 40 years in the health industry, starting with public health, working with underserved and uninsured people, working with all sectors of the population, and helping to build communities and with access, trying to access the best healthcare they can get. Okay.
Amazing. That's amazing.
Back in the day, there was no such thing as Affordable Care Act or what they call Obamacare or the marketplace. So we were doing things to create access to care for people when there was no platform like that.
Got it.
So that's my background. But after serving in public health arena, as I started to retire, believe it or not, I started this career at about 60. The transition to the insurance industry on the other side of the coin, while I've been doing work with the health industries. I mean, in terms of the healthcare market being the actual providers of care, the hospitals, the community health centers,
sure,
all that. So I have a wealth of knowledge about how the healthcare system works. So then after 60, I decided to go into the other side, how to access through the insurance marketplace. Now, right about that time was when we worked so hard under President Obama to actually create this wonderful Affordable Care Act that got passed. And now we have this marketplace that's been in existence over 12 years. So I was at the very front end of that, knocking on doors and making sure people understood what it was.
Right.
Working side by side with the health departments and the state to try to, see how we can get the word out about this new wonderful access to care through the Affordable Care Act. So a lot of people call it Obamacare. It's Affordable Care Act. That's what created this new marketplace we have today.
Yeah.
And now we are at full bloom. We have a federal marketplace. We have state marketplaces. We have all kinds of access to care that we never had before. I mean, people that are older will remember the days when we had, if you had pre-existing conditions, you couldn't get.
That's right. Yep, absolutely.
There was a time when if you were a male, didn't have children, disabled or something, you couldn't get Medicaid. Today, it's not the case.
Wow.
We have a whole lot to be thankful for. Sure. In the last 12 years, while everything is always perfecting, it is 12 years later, I've seen a sea change in 45 million people getting access to care that never did. You know, we have 45 million people without insurance when this
Wow.
whole thing began. So we're
Wow.
now 45 million people insured throughout the country.
Wow. That's amazing.
Yeah, it is amazing. So I started with that, but basically, this whole journey in the insurance industry started with Medicare.
Mm.
Started with helping seniors.
Okay.
I'm a senior myself, so I
Yeah.
understand the whole Medicare system. I had to learn it for myself
Sure.
and for my husband. But in the process, I had again, because I worked in public health, I was aware of a lot of the issues that were out there
Right.
and the challenges in healthcare.
Of course.
So on the other side, for the for-profit industry, which you know, insurance industry is pretty much, it's a very different dynamics because it's about providing healthcare to people, but sometimes it was not always how do you say, as personalized. And I know we talked about and talking about a concierge service kind of
Right.
concept,
Right.
is that I feel that's what I bring to the table.
Yes.
A more personalized effort to design plans or work with an individual around what their needs are as an individual,
Yes.
for families, and for groups, for
Okay.
employer groups.
Yeah. No.
So, and when I say that, I almost use the same model that I used in the healthcare industry. You know, you look at what are the issues, what are the concerns, what are the problems,
Right.
and then whatever you know you see and observe, you're making those observations, you're hearing what the person is saying, what
Sure.
their needs are, and there's very complex. I mean, so complex sometimes that it if you are dealing with somebody that's just coming from an insurance background, and I'm saying there are many very caring people that have a good heart, but what I'm saying is when we have very complex issues, especially for surrounding a whole family,
Right.
from Medicare to individual needs for the family, up to you name it.
Yep.
So when you're looking at all that, and I hear what the person says, and then with my background, I'm able to look at what's the best plan of action for that person. Create
Sure.
a menu of options. And I
Absolutely.
like to give people options because one size doesn't fit all.
Right. No, that's very correct. That's very
Right.
true. That's very true.
We don't have, none of us, we might have little money or lots of money,
Yep.
but you cannot assume anything about anybody, what they want or what they're willing to sacrifice to get what they want.
Absolutely.
So I don't try to peg people because they live in this neighborhood or this, you know, or have this much money. I
Right.
don't do that. I listen to what the person has to say, what their needs are.
Yeah.
Design options, give them options and recommendations based on that. Now, that's my approach. And
Right.
then come up with a plan of action. And it may include other things besides the health insurance.
Right.
It may include other access to state and federal programs they're not aware of,
Right. Right.
or from the public sector, or that there may be a provider that provides financial assistance
Right.
that is internal to that system that people may not be aware of.
And that's because you have that expertise and that knowledge that allows you to be able to have that vast kind of like portfolio and understanding within the industry that allows you to then kind of hand pick what's the right fit for an individual and a family to help make sure their lives are the best quality of life they can have.
That's exactly right. And that's my goal.
Yeah.
The end benefit is when I hear someone say that this has been, I was able to help them access things that they were not able to access, even if in some cases we've had people that are undocumented, people that are not quite fitting in the right timing, meaning it's not open enrollment,
Right.
it's off
Right.
season, there's all kinds of circumstances. But guess what? There's also options even during that time. and
Yeah.
people are not aware of them
Right.
because it is complex. I have to tell you, as much as I have to go through certifications every single year, keeping up with all the changes. And it's no way, as I was thinking the other day, that anyone can possibly keep up with all these changes
Yeah.
in the industry as well as out in the public, private public sector. There's a whole lot of services out there too.
Right.
I also, because of some of my mental health background too, can hear people when they're in distress.
Right.
I get that quite often.
Yeah.
When it's so daunting. The problems are so daunting between whether it's somebody just moving into Maryland,
Yep. Yeah.
but husband is on the other side of the world, or you got so many circumstances that don't fit nicely
Right. Yeah.
a category. So when they're calling a call center, for instance, you're going to get a person that will register and help them with the application.
Right.
When
Absolutely.
it comes to actually helping them to choose the best option, that's not what they're equipped to do.
Right.
So as an authorized, so
Kind of cookie cutter. It's kind of cookie cutter where you just kind of
and
like
you see
filling
the
in
advertisements. You see the advertisements all doing open enrollment, and you're going to talk to somebody at the call center.
Yeah.
And
Yeah.
people have to be aware. Some people can put you in different plans. Some people work for one company. So
Right.
you have to
Absolutely.
be very careful who you're talking to.
That's right, because their objective is maybe different from yours. Their
But-
priorities would be different from your priorities. Yeah.
That's right. And so I think that's that is what I bring to the table. It's more of a concierge service for a broker, insurance broker support to a person. I'm also an authorized broker for Maryland Health Connection, which in Maryland is the marketplace. And as such, I receive the calls when people need that assistance to choose a plan. And then at that point, application, you can go through that yourself.
Yeah.
The whole system is designed so it's a self-help kind of tool, but difficult because you put in the wrong answer to a question, gives you a wrong result, right? That you didn't want. So that's where I come in and help navigate that whole system and navigate the whole Medicare system. And then those, if ancillary services that people need along with that, because the dental, the vision, the cancer policies and other things that help to fulfill those needs that they have. So that is what I believe. And that's, sometimes when you're getting this industry, you say, oh my God, I am not an insurance person.
Yeah.
I'm not an insurance person. However, what I realize is that I have a lot to offer in terms of knowledge, background, aware of the whole system. Because back in the day, when I first began, I used to really feel a little awkward about working in a mental health system when a family comes in and you had to identify the person that had the problem.
Right. Yep.
The whole entire family, but somebody it's either the adult, the child, somebody had to, because the system wasn't equipped to deal with the whole family when they come in. It's like, who is a primary person that needs help? For the whole family. But it was, I remember this distinctly. And then over time, I think we've done better, but that's almost the same way the system is right now. You've got the Medicare, line of business, and some people operate there. Some people operate only in the group insurance marketplace, some on individual, and some people they're captive agents for one company.
Right.
So what I think happens is a lot of people, if they call a call center or a number that goes flashing across the TV screen, you talk to somebody on the phone, and then they find themselves not being able to talk again to that same person. I've had that happen too. some of my clients.
Which, if you're calling a call center, I could totally see that, And so you are working specifically with one of my clients, Assurance Healthcare Services LLC, a skilled nursing agency. And particularly what I'm excited about is the fact that you're helping nurses who, what's awesome about working for a skilled nursing or a nursing agency is that, you have control of your own kind of lifestyle in the sense that you are able to, work for yourself. You're a subcontractor. And so that's awesome that you have that flexibility. But one of the things that you're responsible for is your own healthcare and your health insurances, right? And so as a result, I know a lot of folks try to navigate that themselves. And what's exciting is that Assurance Healthcare Services LLC, they're focused on making sure that they are now providing their nurses and their nursing staff access to you, right? That's one of the benefits of working along with this amazing team, this amazing company, as they're changing lives and making an impact. And providing home health care for folks. So what I want to do in the last couple minutes now, I don't make this a really long video, but I want to make sure folks can understand, as a nurse that's working in the industry and that's trying to navigate this pretty difficult kind of situation for themselves. I just want to give you an opportunity to just kind of let the nurses know, hey, listen, and then this is for nurses that watch this later on. Maybe you're looking for the right agency for you. You're not sure if where you are is providing you the support that you need. And maybe Assurance Healthcare is the agency that you may want to work with because of the fact that they care enough about you to make sure that they're providing these details. Making sure you have the support you need to help you win, because it's great to be a part of a wonderful team environment, which Assurance Healthcare has been able to create. It's wonderful to be able to have the support that you need, the leadership you want. A company that's been around for over 30 years, serving the community, right? But when they take the time and care about the details, that matters, right? That really matters. So I want to give you just a couple minutes just to share, what are you able to provide for these nurses, for them to understand, hey, listen, this is what it looks like to have that kind of white glove approach, that concierge approach to helping them navigate and be able to get the support that they need.
Yes, and I'm absolutely delighted to have a partnership with Assurance, because I can customize and provide access at their convenience. Sometimes it's not always convenient with their hours. I know I have a whole lot of home healthcare, clients, and I am flexible. And that's the thing that is, I think I bring to the table, is the flexibility to work with their schedule, whether it's evening, weekends, whatever. Right. I'm available to them for Assurance to make sure that the nurses have access to the very personalized care that I promise to provide for them, because, again, it's not always convenient. And I know that, when you work 12 hours, 12-hour shift or whatever they are. So because of my flexibility and willing to work along with Assurance and having access, and even providing insurance fairs or whatever, even having access to me at a designated day and time, for, it could be a workshop, it could be a Medicare workshop, whatever that they need, I'm willing to provide. But also, most of all, being there for any client that needs access to, even if they have questions and not sure,
Right.
And it could be any time of year. I think we get so bogged down with this open
right now, open season. Yeah, of course. Yeah.
Always, it doesn't apply for all insurance.
Right.
And there are always special election opportunities that people are not aware of. So that's what I bring to the table, giving them that ability to ask the questions and provide the advice, and whatever I can do. If not, I have partners and other people that can provide things that I cannot.
Right.
Yeah.
That's awesome that you've had this partnership, that you care this much, and it's clear that you're passionate about it. And I again, I know you're busy. I know this is the season, this is the time when your schedule is just so swamped, right? But I'm so appreciative of you taking the time to share and educate. So what I want to do is encourage you. This video has been provided for you by Assurance Healthcare Services LLC for you to learn about and be able to understand how we can help you in this regard. So please get back, reach out to the team. We'd love to have you connect with Shigeo so she can help you to be able to take care of and make sure you get your needs met, right? Because your family has unique needs, and we know that in this time of year, things are crazy, but we want to make sure that you are taken care of and that you take the time while open season is here or otherwise to get access. And we look forward to making sure we continue to educate you. So again, this is Coach Cecil. So grateful for the opportunity to share. Shigeo, thank you so much again for your time. So appreciative. So appreciative. All right, blessings, folks. Thanks so much. Bye now.
Bye-bye.